Today we will talk about viral gastroenteritis. Objectives: define viral gastroenteritis, classify causative agents of viral gastroenteritis, estimate methods of diagnosis for each virus. Viral gastroenteritis is the inflammation of the lining of the stomach, small intestine, and large intestine. Several different viruses can cause viral gastroenteritis, which is highly contagious and extremely common. Viral gastroenteritis causes millions of cases of diarrhea each year. Anyone can get viral gastroenteritis, and most people recover without any complications unless dehydration is occur. Dehydration is the most common complication of viral gastroenteritis. When someone does not drink enough fluids to replace those that are lost through vomiting and diarrhea, dehydration may result. Infants, young children, older adults, and people with weak immune system have the greatest risk of becoming dehydrated. Symptoms: nausea, vomiting, headache, stomach cramps, diarrhea, mild fever, fatigue, chills, loss of appetite, muscle aches. The illness may develop over a period of hours, or it may suddenly start with stomach cramps, vomiting, or diarrhea. Signs of dehydration in adults are excessive thirst, infrequent urination, dark colored urine, dry skin, and dizziness. Signs of dehydration in babies and young children are dry mouth and tongue, lack of tears when crying, high fever, unusual cranky or drowsy behavior, sunken eyes, checks or soft spots in the skull. The causative agents of viral gastroenteritis are several types of viruses that can cause this illness. Most common of these viruses are the rotavirus, calicivirus, adenovirus, and estrovirus. We can demonstrate that rotavirus is the most causative agent of gastroenteritis in general, and it can cause the most cases more than other types of pathogens such as bacteria or another types of parasites. Also, it is the most causative agent of the viruses. It can cause several hundreds cases of infection with viral gastroenteritis more than adenoviruses, caliciviruses, and estroviruses. Now we will talk about rotavirus. Rotavirus is the leading cause of gastroenteritis among infants and young children. Symptoms usually appear 1 to 3 days after exposure to this virus. Rotavirus typically causes vomiting and watery diarrhea for 3 to 7 days. Along with fever and abdominal pain, rotavirus can also infect adults who are in close contact with infected children, but the symptoms in the adult will be milder. Important properties of rotavirus. The genome of this virus is segmented double-stranded RNA, consists of 11 segments. The RNA is surrounded by a 3-layered protein capsid. There is no envelope of this virus. This virus consists of RNA-dependent RNA polymerase, and the virus can be transmitted by the fecal-oral route. There are 6 viral proteins. The most important are the outer capsid protein, viral protein type 4 and 7, as they carry epitopes with a significant role in neutralizing activity. This virus consists of 9 serotypes. 5 of them are responsible for the majority of human disease, from A to E. Group A rotaviruses are the most frequent human pathogen. Pathogenesis. Rotavirus infects cells in the villi of the small intestine. They multiply in the cytoplasm of enterocytes and damage their transport mechanism. One of the rotavirus non-structural protein, which is the most important non-structural protein, which is non-structural protein type 4, which considered the viral enterotoxin and induced secretion by triggering a signal transduction pathway. Damaged cell may slough into the lumen of the intestine and release large quantities of virus which appear in the stool. Viral excretions usually last 2 to 12 days in healthy patients, but may be prolonged in those with poor nutrition. Diarrhea caused by rotaviruses may be due to impaired sodium and glucose absorption as damaged cells on villi are replaced by non-absorbing immature CRAB cells. It may take 3 to 8 weeks for normal function to be restored. This figure shows to you mechanism by which rotavirus can cause diarrhea. The infection of the initial cell by luminal virus leads to virus entry, then encountering, then transcription. Finally, we have the translation of viral protein. The most important non-structural protein type 4 of the virus can disrupt tight junctions which lead to paracellular flow of water and electrolytes. Also, this non-structural protein will bind to specific receptor and trigger a signal cascade through phospholipase C, which lead to release of calcium. Non-structural protein type 4 can stimulate the enteric nervous system, which in turn signals an increase in the intracellular calcium. In figure B, we can demonstrate the normal small intestine. Figure C shows to you the reflex of enteric nervous system. This slide we talked about it already. Now, clinical findings. Rotavirus can cause the major portion of diarrhea unless in infants and children worldwide. The incubation period is 1 to 3 days. Typically, symptoms include watery diarrhea, fever, abdominal pain, and vomiting, leading to dehydration in some patients. In infants and children, severe loss of electrolytes and fluids may be fatal unless treated. Now we will talk about laboratory diagnosis of rotavirus. This virus can be demonstrated in the stool by enzyme immunoassay. Serological tests can be used to detect the antibody titer rise, especially by ELISA. Genotyping of rotavirus nucleic acid from stool specimen by the polymerase chain reaction is the most sensitive detection method, or it is the gold method for detection of this virus. Immunity against rotaviruses. By the age of 3 years, 90% of children have serum antibodies to one or more types. Rotavirus reinfections are common. It has been shown that young children can suffer up to 5 reinfections by 2 years old. Local immune factors such as secretory IgA or interferon may be important in protection against rotavirus infection. Asymptomatic infections are common in infants before age 6 months, the time during which protective maternal antibody acquired passively by newborns should be present. Such a neonatal infection does not prevent reinfection, but it does protect against severe disease during reinfection. Treatment and control. Treatment of gastroenteritis is a supportive. It already used to correct the loss of water and electrolytes that may lead to dehydration. acidosis, shock, and death. Management consists of replacement of fluids and restoration of electrolyte balance, either intravenously or orally. An oral live attenuated rotavirus vaccine was licensed in the United States in 1998 for vaccination, but this vaccine already has a serious side effect. In 2006, an oral pentavalent bovine-based rotavirus vaccine was discovered in the United States. Now we will talk about calciviruses. Calciviruses cause infection in people of all age. Norovirus is the most common calcivirus or calciviruses that can cause viral gastroenteritis in adults. People infected with norovirus typically experience nausea, vomiting, diarrhea, abdominal cramps, fatigue, headache, and muscle aches. The symptoms usually appear 1 to 2 days after exposure to the virus. Important properties of norovirus: the very non-enveloped, non-segmented, linear, positive sense, single-stranded RNA. The protein is the icosahedral capsid composed of a single protein. The replication of this virus will be in the cytoplasm. Human viruses are non-cultivable. Pathogenesis and immunity. Infection by norovirus was observed to produce an expansion of the villi of the proximal small intestine. The mechanism by which the area is produced is unknown, although it has been suggested that the delay in gastric emptying observed in norovirus gastroenteritis may play a role. Infection by norovirus induced serum antibody response. 2 weeks after infection with this virus, there is an increase in jejunal synthesis demonstrated for IgA, and most patients are resistant to reinfection for 4 to 6 months. Laboratory diagnosis of norovirus. First of all, we have stool electron microscopy, polymerase chain reaction to determine the viral genome. ELISA can be used to detect viral antigen in stool. Latex agglutination for viral antigen. Another virus that can cause viral gastroenteritis is the adenovirus. Adenovirus mainly infects children younger than 2 years old. Of the 49 types of adenoviruses, one strain only can cause gastroenteritis, causing vomiting, diarrhea, and other symptoms of this illness. Symptoms typically appear 8 to 10 days after exposure to this virus. Important properties. This virus is already non-enveloped, medium in size, genome linear, double-stranded DNA. They are the only viruses with a fiber protruding from each of the 12 vertices of the capsid. The fiber is the organ of the attachment, and it is considered as a hemagglutinin. There are at least 51 antigenic types. The fiber protein is the main type-specific antigen. Human adenoviruses are divided into 6 types on the basis of physical, chemical, and biological properties. Pathogenesis of adenovirus. Adenoviruses infect and replicate in the epithelial cells of the respiratory tract, eyes, gastrointestinal tract, urinary bladder, and liver. They do not spread beyond regional lymph nodes, Group C viruses persist as latent in the adenoids and tonsils. The viruses are transmitted either by aerosols or by fecal-oral routes. Laboratory diagnosis. 1. Isolation of the virus in the cell culture. We can use shell vial technique to detect the specific antigen. We can use complement fixation, hemagglutination inhibition. Also, PCR can be used to detect viruses in tissue samples. According to treatment and control against this virus, there is no specific treatment for adenovirus infection and vaccine is no more used nowadays. Finally, we have estrovirus. Estrovirus primarily infects infants and young children, but adults may also be infected. This virus causes vomiting and watery diarrhea. Symptoms usually appear 3 to 4 days after exposure to the virus. The symptoms are milder than the symptoms of norovirus or rotavirus infection. Infections occur year-round, but the virus is most active during the winter months. Important properties. Estroviruses are about 28 to 30 nanometer in diameter. It demonstrates a distinctive star-like morphology in the electron microscope. The precursor of the capsid protein 87 KDA gives rise to the structural capsid protein, the viral protein 26, viral protein 29, and viral protein 32. These proteins, especially viral protein 26, seem to be responsible for the antigenic variation observed among the different serotypes. They contain single-stranded positive sense RNA. The viruses are transmitted by the fecal-oral route. Pathogenesis and immunity of estrovirus. The pathogenesis of this disease induced by estroviruses has not yet been established, although it has been suggested that the viral replication occurs in intestinal tissue. Studies in adult volunteers have not clarified the pathogenic mechanism. Symptomatic estrovirus infection occur mainly in small children and the elderly, which suggests a reduction in antibodies in recent years. But the determinants of immunity are not well known. Laboratory diagnosis. Tests that a healthcare provider might order to help identify the virus include stool culture to see if the virus is present, blood tests to look for antibodies to the virus, reverse transcription polymerase chain reaction to determine which estrovirus is causing the illness. Summary. Viral gastroenteritis is the inflammation of the lining of the stomach, small and large intestine. Several different viruses can cause viral gastroenteritis. The main symptoms of viral gastroenteritis are watery diarrhea and vomiting. Dehydration considered the most common complication. Infants, young children, older adults, and people with weak immune system have the greatest risk of becoming dehydrated. The viruses that can cause viral gastroenteritis are transmitted from person to another. Most cases of viral gastroenteritis resolve over time without specific treatment. The primary goal of treatment is to reduce the symptoms due to this disease. And thank you.